What if the most important signal in your medical practice is the one everyone has learned to ignore? In Akron, Ohio, Destiny Moore noticed something about her 2-month-old daughter, Legacy Harris Moore. Legacy's eyes sometimes turned inward. Later, they rolled upward and appeared to get stuck. She was also struggling with early developmental milestones. Some tests were normal, but normal did not explain what Destiny was seeing. So she kept asking questions. Eventually, genetic testing revealed that Legacy had elongator complex protein 2-related disorder, an extremely rare neurological condition. Fewer than 30 cases have been reported in the medical literature. At Akron, children's physicians, including Dr. Carrie Costin and Dr. Matthew Ginsberg, became involved in her care, while physical therapist Rachel Larkin worked with Legacy on early development. There was no easy answer, but there was progress. And that story made me think about medical billing. Because healthcare does not have a data shortage, we have a signal problem. Physicians understand this instinctively. A patient's numbers may look normal, but something does not fit. So you ask another question. You look again. You investigate. Why don't we apply the same thinking to revenue cycle management? A claim is denied. Someone fixes it. Then the same denial happens again and again. We call it billing. Maybe it is actually an information problem. One denial is an event. Repeated denials are a pattern. And patterns deserve investigation. The question should not always be, how do we get this claim paid? It should be, why are we creating this problem repeatedly? That is the difference between reactive billing and intelligent operations. And it is why I am skeptical of simply automating medical billing. If the underlying process is broken, automation can make you break it faster. Automation without understanding is just faster confusion. The more interesting question is, what are we failing to notice? Which payer suddenly changed behavior? Which documentation problem keeps returning? Which service is consistently underpaid? Which administrative task consumes hours every week? Which problem keeps pulling physicians away from patients? Your billing team probably already knows some of the answers. Frontline employees live inside the exceptions. The person closest to the problem may be holding the most valuable clue. That is the lesson I take from Destiny Moore. She did not have the diagnosis. She had the observation. She noticed something did not make sense. She kept looking. Physicians do this every day. Healthcare operations should do it too. That is the thinking behind On Next. The goal is not another dashboard. It is to connect clinical documentation, coding, claims, payer behavior, denials, payments, compliance, and financial information. So practices can see patterns earlier and act before small problems become expensive ones. I believe the future of medical billing is not simply about maximizing revenue. It is about maximizing predictability, knowing what is happening, knowing why, knowing what deserves attention, and knowing what should never happen again. If I were running a physician practice today, I would start with one simple exercise. Take 90 days of denial data. Find the top 5 recurring problems, trace them upstream, calculate the cost in money, staff time, physician time, and rework. Then fix one, not 10 measure it. Learn from it, then move to the next. Because the best administrative problem is not the one your team solves quickly. It is the one your team never has to solve again. So I want to ask physicians and clinic owners, what is your practice trying to tell you that you have learned to ignore? The recurring denial, the payer behavior, the documentation problem, the spreadsheet everyone hates, the administrative task that keeps pulling you away from patients. Tell me in the comments. And if this perspective resonates, repost it so another physician or clinic owner can join the conversation. Look for the signal. Question the process. Fix the problem upstream. That is where better healthcare operations begin.